Scanning the room. Alright, so I'm walking the room, wash my hands. Okay, provide privacy. Hi, my name is Bilal. I'm your student nurse today. Do you have any signs of allergies or pain today?
No.
Can I have you state your name and date of birth?
Elliot Perdome, June 29th, 1992.
Check the wristband. Okay, and then do you know where you are right now?
University of Detroit Mercy.
Okay, you know what year it is today?
2017.
So times 3. He seems to be well groomed, appears stated age, no signs of illness, mood and affect are both appropriate. Next I'm gonna move on to the head, start assessing the hair. Hair is evenly distributed, no signs of miscoloration. It's now the head is normal cephalic, no signs of any lesions on the head, no lice, no any of that. Next I'm going to move on to check the color of the skin. It's normal for ethnicity, no lesions. If there were lesions, I would have assessed for asymmetry, border color, diameter, and elevation. And next I'm going to assess the eyes. Can you hold on your eyelids like that? Conjunctiva is pink, sclera is white. Alright, and then I'm gonna assess for the pupils. I'm gonna assess the pupils. Okay, so pupils dilated in both eyes, about a 5 right now. So next I'm gonna have you follow my thumb light. And then accommodation. So pupils are parilla, they are accommodated. No signs of any extraocular movements. No lesions. Next, I'm gonna have you open your mouth. Say Tonsils are at a +1. Mucous membranes are pink, moist. The tongue has no lesions. No lesions in the mouth. The gums are pink. No signs of gingivitis. His teeth have no cavities, no missing teeth, no fillers, none of that. Next, I'm gonna have you, can you smile for me? And then can you puff out your cheeks, raise your eyebrows, then close your eyes. Tell me where I'm touching.
Forehead, left cheek, right cheek.
Alright, so cranial nerve 5 and 7 are intact. Next, I'm going to assess the carotid arteries. First, I'm going to palpate. Alright, so rate is equal, rhythm is regular. It's about a +2 for the grade. Next, I'm going to auscultate it with the bell. Alright, sounds normal, no signs of bruise. Next, I'm going to move on to the upper extremities. So, just assessing, no signs of any lesions, proper hair distribution, warm to the touch, moist, no colors ready for ethnicity. Now I'm gonna check the fingernails. So can you see them both? Cap refills at 2 seconds. Can you put your hands like this for me? No signs of clubbing. Can you touch your thumbs to your fingers? So thumb up positions, good. Next, I'm going to check your radial pulses bilaterally. Alright, so the radial pulses are, the rate is equal, the rhythm is regular, it's at a +2. I'm going to check the brachial pulses bilaterally. Alright, so the rate is equal bilaterally, and then the rhythm is regular. It's at about a +2 as well. And then next I'm going to, can you take off your shirt for me? I'm going to assess the heart now. for the heart, I'm going to start at the second intercostal space of the right side, and that is going to be the aortic. Second. Then move on to the pulmonic. Down to the Erb's point. And then to the tricuspid. And then fifth intercostal space, mid-clavicular line, is the mitral. I'm going to sit here for a minute and count. Okay, and then I'm going to go back up with the bell. From the mitral to the tricuspid, to Erb's point, to the pulmonic, and then back to the aorta. Alright, so all heart sounds sound regular. I heard S1 and S2, no signs of S3, S4 or murmurs, no skip beats. And next I'm going to assess the lungs. So, can I just have you breathe in and breathe out for me? Okay. If you can lift your arm up for me, check the mid-exhale, breathe in. One more. On the other side. One more. Now if you could just turn over to your back. Check the posterior. Breathe in. Can you just put your shoulders back for me? Alright, so all lung sounds sound clear. No signs of wheezing, crackles, no stridor, none of that. No stridor while he's breathing. Next I'm going to ask you to stand up for me. I'm going to check the, turn around. I'm going to check the costovertebral angle. Okay, is there any tenderness in that?
No.
Check the other one. Alright, no tenderness in that either?
No.
Alright, then can you bend over so I can assess the spine? Alright, so spine is symmetrical, it's no signs of scoliosis, kyphosis, it's midline. Yeah, and then can you stand up for me? And then, can you lay down for me? So next I'll move on to the abdomen. First I'm going to inspect. So college right for ethnicity, no signs of lesion. If there were lesions, I would have assessed for assessed for if it's asymmetrical, the borders, the color, the diameter, and the elevation of it. Hair is probably distributed. There are 4 quadrants: the right upper quadrant, left upper quadrant, left lower, right lower. In these 4 quadrants, the right upper, you have the liver and the gallbladder. In the left upper, you have the stomach and the spleen. Left lower, you have the sigmoid colon and the left spermatic cord. And the right lower, you have the ileum and the appendix. Next, I'm going to auscultate. Start in the right upper. Are you feeling any tenderness today?
No.
Alright, so bowel sounds are normal and active. No hyperactive, no hypoactive bowel sounds. Next I'm going to do light palpation. So just let me know if there's any tenderness or pain. So move on to the left upper, down to the left lower, all the way back to the right lower. Alright, so the skin was warm. There were no signs of distension, no tenderness. It was not hard. It was soft. Can I have you sit up for me? So no signs of jugular vein distension. Then I'm going to move on to assessing the lower extremities. So take your socks off. Just one is fine. Alright. So there's no signs of lesions. If there were lesions, I would assess for asymmetry, border, color, diameter, elevation. Hair is properly distributed. Colors are for ethnicity. So first, I'm going to assess the dorsalis pedis pulse bilaterally. Wait, can the camera see what I'm doing?
I think so, yeah.
Just so, assessing the dorsalis pedis pulse. This would be bilaterally. And then you want to hold it? Yeah. And then the posterior tibial bilaterally. All right. And then I'm going to check for capillary refill in the toes. So there is capillary refill. It's at a +2, or it's at a 2-second capillary refill. Okay. Alright, and then I'm going to check for the strength in your lower extremities. Can I have you kick up for me? Alright, and then go back down. Alright, so he's at 5 out of 5 for strength. Oh, and then can I have you do hand grasps for me? Alright, he's at 5 out of 5. Can I have you stand up for me? And then can you close your eyes and just stand there? Alright, so the Romberg test is negative. Next I'm gonna have, can you walk in a straight line for me? Alright, so the get up and go test. I'm assessing his gait. His gait is normal. He walks in a fluid motion. No signs of weakness of his gait. And then, is that it?
That's it, yeah, that's it.
Alright. I think that's it.